Thank you for joining us for this MD Magazine Peer Exchange, which explores the treatment of osteoarthritis of the knee. Osteoarthritis is the most common form of degenerative joint disease, and it's a leading cause of disability in people over 50 years of age. It's a debilitating form of arthritis that most commonly affects the knees and the hips. The typical symptoms of osteoarthritis of the knee include gradual onset of knee pain, stiffness, and swelling. Treatment often starts with conservative measures and progresses to injectable medications. And in this peer exchange, my colleagues and I will explore the diagnosis, patient management, and treatment of osteoarthritis of the knee, including the clinical rationale for treatment decision-making. I'm Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University College of Physicians and Surgeons, and I'm the associate director of surgical intensive care at New York Presbyterian Hospital. Joining me for this panel discussion is Dr. Richard Iorio, orthopedic surgeon, chief of adult reconstruction and William and Susan Jaffe professor of orthopedic surgery at the New York Langone Medical Center. Dr. Paul Lachiewicz, orthopedic surgeon, Chapel Hill Orthopedics, and sports medicine and consulting professor of orthopedic surgery at Duke University School of Medicine. Dr. Andrew Spitzer, orthopedic surgeon and director, Joint Replacement Program at Cedars-Sinai Orthopedic Center. I want to thank all of you guys for joining me here today. So let's begin at the beginning. We're talking about osteoarthritis. So why don't we define it? What is osteoarthritis?
So osteoarthritis is a degenerative process, as you mentioned in your introduction, that ultimately is caused by a host of combining intrinsic and extrinsic factors that destroy the cartilage on the ends of the bones. And over time, what happens is that the bones begin to grind against bones. That smooth cartilage that normally lines the ends of the bones and enables smooth movement and stability, that is destroyed and deteriorates. And ultimately, as the bone begins to grind against bone, creating inflammatory mediators, generalized inflammation within the joint, swelling, that results in pain. And that pain subsequently really creates the disability that is the hallmark of osteoarthritis of the knee.
You know, it's interesting that you started off with a mechanical insult, and then you went toward mediators and inflammatory mediators. Whereas it seems to me the other common form of arthritis, which is rheumatoid, right, starts off with an inflammatory mediator and goes toward pain. Am I getting this too simple?
Well, I think there's a lot we don't know about arthritis. I was always taught it was a disease of the cartilage cell. For some reason, the cartilage cell becomes sick, and that's what I tell the patients. I said, your cartilage is sick. It's not making the matrix or the spongy substance that is like the shock absorber for your knee, and we don't quite understand why that happens.
You know, it's interesting that you say that, because what I was always taught, it was this hammering on the cartilage. Eventually, the cartilage gets destroyed. But the body should be able to make new cartilage. I mean, day in and day out, we're destroying something, right? So what his point is, as I take it, something's wrong with the regenerative process after a while.
So cartilage is a very metabolically slow to act tissue. It doesn't heal itself well at all. We haven't really solved that problem yet. But I think what we have to remember is degenerative arthritis is the end of the process. There are multiple insults that can cause this process. Those can involve inflammatory responses to the arthritic process, mechanical issues with alignment or deformity, and also wear and tear, which can result either from trauma or perhaps from some metabolic environment that also inhibits the cartilage from functioning correctly.
So it's not just simply hammering away at your cartilage until it's gone.
Well, that will do it if you do it severely enough, but there are other factors that can contribute to the...
I think the combined issue of both the intrinsic factors, that sick cartilage, and the cells that are not making the matrix, and with that, the extrinsic factors, the pounding away, the meniscal tear, the overuse over a lifetime, or perhaps some other injury that creates an irregularity in the joint surface, all of those things, I think, combine to this sort of final common pathway of osteoarthritis, which is the degenerative process.
But you know what I think I heard from all three of you, and maybe I'm reading into this, please tell me, is that if you do enough pounding on cartilage, you seem to expose antigens. You expose something and that induces an inflammatory response to something that shouldn't be exposed to.
I'm not sure that's exactly correct.
Okay.
Because there are people who can run until their 80s or 90s and never get arthritis. So I think there's a lot we don't understand. There's probably some genetic predisposition. But one of the things I wanted to pick up on, you said before, why doesn't the cartilage repair itself?
Sure.
It actually does try to repair itself, but it does so in an abnormal way, in that the body will regrow cartilage at the edges of the joint, and those eventually become bone spurs or osteophytes. And so it's an abnormal repair process, and that sometimes leads to symptoms.
I got it. So in terms of evolution, if you're running away from a saber-toothed tiger, it doesn't really matter because you're only 30 years old, and you may not get to 40
That's
anyway.
right.
You're not playing football at the age of 38.
Exactly.